Next thing we need to cover is what is called the Heimlich Maneuver. Is anybody familiar with the Heimlich Maneuver? Okay, what is it used for? Right now? Yes, it's used for a choking scenario. All right, the way the Heimlich Maneuver works is very straightforward. It's basic. Your chest is a sealed cavity. Okay, there's air in it. When you choke because an object or food gets stuck right here. You have a windpipe and a food pipe that sit back to back. You have a little flap of skin that says breathe or eat. Only when an object is stuck there are you choking. So what we do is we use the air in your chest to engage that object, to get it to move a little bit. If it moves up, typically you will cough it out. If it moves down, typically you're able to swallow it. So the way the Heimlich Maneuver works is you make a fist with your non-dominant hand. You place the thumb side into the belly button. You grab your fist, and then you drive your fist up and in. Okay, you want to be underneath these ribs. They're called the floating ribs. If you cross them and squeeze, you will no doubt break those ribs. You want to try to avoid that. So the Heimlich Maneuver is done by the belly button. All right. Does anybody know what the universal sign of choking is? Okay, what's the sign? Yes. Okay. If you look at a poster or anywhere that they have these things that depict CPR, they will always show the victim doing this. It's considered to be the universal sign. All right. Once you see that, then you can go ahead and do the Heimlich Maneuver in that way. Okay. You position yourself behind the person, you grab, and you drive that fist up and in. All right. Everybody got that? What we're going to discuss is what is called the Heimlich Maneuver. Okay, have any of you heard of the Heimlich Maneuver? Yes. All right, the Heimlich Maneuver is what is used to alleviate a choke. All right, I've assisted 2 people in real life with a choking thing, and it's not a fun thing to have to do. And I can almost guarantee you, at some point in your life, you will need to assist someone with choking because it's a very common thing that occurs. All right, now, when people choke, the reason they choke is because an object gets stuck right here. Okay, so what we're going to try and do is to either move it up and out or bring it back down again. Either way is fine. As long as it's not stuck here, that's the only thing we care about. All right. How you do the Heimlich Maneuver is you make a fist, you place the thumb of that fist into the person's belly button, your other arm comes around like a belt. In other words, I'm low on them. And yes, and you're going to drive the fist up and in. As hard as you need to, as many times as you need to, until you get a positive response. All right, I'll explain a little later what a positive response is. All right, the Heimlich Maneuver is a violent, painful act for the victim. If you've ever seen the movie Mrs. Doubtfire, that's really what it looks like. All right, I need a volunteer. Come on down.
Wait, are you going to really do it?
One down. Everything will be fine. Trust me.
Enjoy it.
Alrighty. What is your name?
Tiffany.
Tiffany? Tiffany, stand right there.
Can we open
Try and face your peers.
Don't throw up on us.
One step forward. Good. Alright. The reason we need a volunteer is because we're going to recreate a choking scenario. You, my friend, will play the part of the choking victim in the restaurant. I will be the rescuer. Are you ready? Come on. What are you doing? Come on. Put your hands out. I'll tell you. All right.
She's so like a model.
I should have mentioned this, so I need to mention this. Does anybody know what the universal sign of choking is? That's the one. Right. Okay. This is what they call the universal sign of choking. Unfortunately, nobody does this. Okay, I've seen 2 people choke for real, and neither one did this. Both of them did this. So, I've now given that little thing a name. I call that the dance of death. All right. So let's suppose.
I'm not doing dance of death.
You are.
Francisco.
No. Okay. So right there, remember. Oh, I forgot. The most important part of this thing is you volunteered. All right. Now, so here we go. You're sitting there with your people at the table eating. I'm over here at my table eating. Okay. All of a sudden, you pop up out of your chair. Dance of death in the restaurant. Take one.
You look relieved.
Okay. I'm going to let this go a little while, see what you want to do. All right. Actually, it's pretty good because you didn't do the one thing that I always have to caution about. So you were good. All right. Sometimes, because I didn't tell her what to do, and she did it exactly right. She did sort of a dance of death, but pretty good. All right, but she did not make a sound, and that's the critical thing. Because sometimes I'll have people do this, and they'll go like this. I'm joking. They're not, because you just made some noise. Okay? People who can talk.
I almost choked once and I was really quiet.
People who cough are not choking either. People who are quiet are the ones that you need to help. So, what exactly do you as the rescuer need to do? All right, so here's what you're going to do. Assuming you recognize that dance as the dance of death, you will go up to the victim like this, you will grab their arm, and you say to her, "Are you choking?" So now she even did the next part right. She went like this. Because sometimes people go like this. I don't know what that means. So, you would have to prompt her. You would say, okay, if you're choking, shake your head up and down. Stay calm, which apparently is not a problem for you. I'm going to help you. Now, it's important that you do that in that exact order. Okay? And sometimes people say, well, why do I need to do all that? Well, I'm going to show you why. Okay? I'm going to be the choking victim in the restaurant. Okay? Here's what's going on in my head. All right, I think I'll do the dance of death. Okay? Because I'm going to die here today in this restaurant because I can't breathe and I can't talk. So I'll just stand here and do the dance of death. She recognizes the dance of death. She comes over and grabs my arm, and what does she say to me?
Are you choking?
No, I'm married, thank you.
Wait,
So,
actions nod your head, right?
exactly right. So,
Nod your head if you're choking.
and then you say, stay calm.
Yeah, stay calm. Stay calm.
I'm going to help
Wrap
you.
them around me?
Okay, I'm going to help you. All right, does everyone understand why they need to do what they need to do? Because you got to remember, I'm not in my right mind. And she is now communicating with me. She's telling me, I know you have a problem, and I'm going to help you with that problem. Okay, you cannot just grab people and squeeze them. Because you can imagine, I go up to her table. You ever wonder?
No.
Imagine, I go up to her table, and I just pick her up and I start grabbing her. The people at her table may not be too happy about that, okay? So you need to clearly indicate that you are helping with an emergency, and this is what your intentions are. All right, are you ready?
Oh, you gonna do it?
Of course. You ready?
Yeah, but not for real, right?
I'm on.
Oh, it's supposed to say.
I can't really squeeze people, so we will use the mannequins to do the demonstration. Okay? Are we good? All right, so there are a couple of what ifs, so let me go through them first.